Hi, everybody. Welcome back to Pelvis Party. My name is Becky Monpetit. I'm the owner of Rochester Local, and I'm here with Dr. Melissa Richards. She's the Division Chair of Hospital and Surgical Services at Olmsted Medical Center and also an OBGYN, and Britt Marshall in the Communications and Marketing Department at Olmsted Medical Center. And our power trio is back together.
Love it.
It's been a little while.
It's been a hot second.
I've really missed you all.
I know so much has happened. Wait, it looks exactly the same outside right now as it did 2 months ago.
So today we thought we would start talking a little bit about PCOS.
PCOS.
Not an easy topic because it's not a completely understood topic, right? So
Exactly.
what is PCOS?
So PCOS, the non-acronym is Polycystic Ovarian Syndrome. It's a diagnosis of exclusion. So when I have a patient come in who's said they've done their Google search and they have PCOS, we have to take a step back and we have to get the history. So typically patients with PCOS, they've noticed that their periods are maybe a little off. They might have issues with acne or what we classically think as male pattern hair growth or hair loss. As well as ultrasound findings where you look at the ultrasound and you look at the ovaries and they look like almost a pearl necklace, all these little polycystic appearing little follicles. So the diagnosis is typically meeting 2 of 3 criteria of what I just brought up. So irregular periods, meaning your periods are greater than 35 days from day 1 to day 1. Or perhaps you've noticed, gosh, I have really significant acne, or I'm kind of doing my hair to cover up bald spots or even like hair growth. We are still learning about PCOS and research in women's health is not always as robust as we would have hoped years ago. So we're still climbing that mountain.
You have people Google it and come in thinking that they have it. How many of those people actually do have it?
That's a really great question. It's actually really common. About 10% of women in the U.S. or people with uteruses have PCOS or people with ovaries. So it's not uncommon. A patient coming in feels that they have PCOS and lo and behold, they do. When I see a patient, it's usually one of 2 concerns. They've been trying to get pregnant over a period of time and they're looking for different causes of fertility issues and PCOS pops up and they see, oh, like periods that are irregular. Well, that's me. And then I do have a little bit of acne, and that kind of puts them down a rabbit hole. So it's actually not uncommon for them to be correct in that diagnosis. What makes me sad is when you Google PCOS on Google, it's the saddest looking human. Like, Google it. They need to put a different picture because she looks like forlorn and she just looks a little tough. But
it's not hopeless, though.
It is not hopeless. So when I think of a patient who comes with PCOS, I get that history. I also do a lot of education, right? Shocker, I do education at my clinic visits. To get a better understanding, first of all, it's poorly understood, but we do know that it can be a process that has increased androgen, or what we kind of think of as more the male hormones, hence the acne and the hair issues. We also know that patients with PCOS have a higher issue or more issues with high blood pressure, diabetes, high cholesterol. Kind of a bummer, right?
Yeah, it's a bummer.
Womp, womp. Their metabolism. We have something's up with their metabolism. We also know, as I mentioned a little bit earlier, that these are people who might have fertility issues. It's really hard to know when to have sex because you don't know when you're ovulating. I can tell you when you ovulate and when you get your period, but that's not really helpful. And on the flip side, I have patients who will tell me, oh, I haven't been able to get pregnant. I have irregular periods. And then they come in for their annual exam and lo and behold, they're 16 weeks pregnant because it's normal for them to not get a period for 4 to 5 months. From a gynecology standpoint, when you're skipping periods or you're having this growth of that lining of the uterus, a couple things are also concerning. As that lining grows, knotty things, precancerous or cancerous cells can form in those cells. And then also when you finally shed that lining, if you've kind of been building a lining over months, that can be like a monster period.
Oh,
right?
sure. Yeah.
Right? Exactly. We know this PCOS is not a complete bummer, but to me, once again, kind of understanding it and having a better grasp on what's happening lets you control what you can control.
It's actually scary, right? If you don't know what's going on, scary, maybe doesn't feel like you have a lot of dignity in that situation either. And one thing that I have read about a little bit and kind of experienced myself is even if you have a lot of PCOS symptoms, doesn't mean you have PCOS.
Right.
I know that's something that I explored when I was younger. At least my primary care did, because I had really heavy periods and acne and just, metabolism issues and just like, is this it? But as you said, it really is a diagnosis of exclusion and trying to figure out other things that are going on. So it's crazy that we don't have these markers for it, which is another reason for increased funding for women's health related issues.
Absolutely.
Right? And so
they were looking at that even at, how old were you?
I was probably in my teens, in early 20s.
Impacts anyone, any age.
Yes. Yes.
Absolutely.
So what are treatments like for PCOS?
Great question. So this is where I get into like, know what you know, and then control what you can control. Okay. So I think of it as kind of 4-pronged depending on why you're coming in, and that changes as we go through our life. So if I have a patient who's coming in wanting to get pregnant, a procreative counseling consultation, fertility counseling. After we make that diagnosis of exclusion with PCOS, we talk about, what we can do with behavioral changes like PCOS. Same thing we tell everyone: exercise, work on diet, as well as we do have some medications that typically I have a lot of luck, oral medications that help patients with regular ovulation, so then they know when to once again have sex. It's hard to know when to have sex if you don't know when you're ovulating. And then also there's some other medications with the difference in how people metabolize, because moving into metabolic issues that patients can have, meaning the high blood pressure, the diabetes, high cholesterol, kind of looking at what medications are out there, kind of these classic weight loss medications. We're looking at that. Patients will probably respond really well to that who have PCOS. And then from the gynecology standpoint, we need to protect that lining of the uterus and also protect the patient from having that monster period. So it's really important. At minimum, they have a withdrawal bleed at least every 3 months, which there's a medication you take for 10 days for patients who want a little bit tighter control. There are other options available. And then some things that are really important to us, like for some of us, how we look, right?
Yeah.
So there are medications for hair growth. There are medications out there to help with acne, hair loss available too. We really have to think about, what is the goal of the patient, and then how we're going to get there after we've now made this diagnosis.
Right.
Absolutely.
So it's managing each symptom really, and addressing how the patient wants to, really attack that specific area of their diagnosis. But it sounds like once PCOS is diagnosed, there are definitely things that can happen to improve quality of life. Right?
Absolutely. This is a do not settle moment too.
Yes. Yeah. If you have these, as we say here on Pelvis Party, you don't have to settle for something that is just happening to you related to your health. Ask your primary care, even if you're like, oh, is it not? Talk it through with them. And so they can help you make an informed and educated decision and diagnosis.
Absolutely.
And improve that quality of life, ladies.
Absolutely.
People, right?
People.
Yeah.
It's interesting because not every patient who walks in the door although 1 in 10 has PCOS.
Right.
So it's really important that maybe the person does not have PCOS.
Yes.
But we might be looking at a different diagnosis.
Yep, right.
And even if you don't have PCOS, if you have monster periods, if you're trying to get pregnant, if you're having crazy issues with acne or hair loss, like just because you don't have the PCOS diagnosis doesn't mean that some of the treatments that we utilize for PCOS wouldn't be successful for that person.
Right. So it's about finding solutions to the things that are hindering you and moving forward confidently, right?
Absolutely.
Well, this was a good one.
I like
Thank you
this.
so much. I appreciate the both of you, Britt and Dr. Richards. And if you would like to see more episodes of Pelvis Party, please head to rochesterlocal.com/pelvisparty.